Approximately 6 hours after the injury begins the debridement phase. It is here that white blood cells enter the wound site for the purpose of cleaning up the contaminated tissues. These white blood cells then take on a characteristic purulent or pusty appearance. Once the wound has been cleaned up, the repair phase begins. A type of cell called the fibroblasts begins laying down fibrous tissue that may become scar tissue. These cells and their fibrous bands assist in pulling the wound edges together. This is how gaping wounds close over time. This phase is usually occurring within 3 to 4 days from the time of the injury. This repair phase is sometimes called the lag phase due to the minimal observable changes noted to the wound during this period. It is also during this phase that tiny blood vessels called capillaries begin to infiltrate the wound site. This gives the healing tissues a bright red appearance called granulation tissue. The cells of the skin called epithelial cells begin to migrate across the wound also. The smaller the wound, the quicker the epithelial cells will cover the healing wound. Thus, surgical incisions become epithelialized very quickly when no infection is present. The last phase is called the maturation phase. It is at this time that the scar tissue is at its greatest strength. The cells brought to the healing wound begin to retreat, and the original cell types begin to return. This phase continues to attempt to recreate original anatomical structures for weeks to months to years in some cases. Though this is the ideal process that every wound goes through, many internal and external factors interfere with the ideal. Old age, poor nutrition, and pre-existing diseases are 3 common reasons a wound might heal up slower than expected. Wound contamination and infection certainly lead to a slowed healing process. Compromised circulation, as might be caused by a bandage that is applied too tightly, is a preventable factor that slows healing. Steroids, because of their potent effect on the immune system, may also slow or retard the time it takes for healing. Any foreign substance in a wound, including topical ointments, tend to slow the healing process.
Anybody need to stop and take notes?